Welcome once again to Stay Alive with Church Alive. And for 30 years, we have done our best to bring you quality information, resources, and services that have improved your lifestyle. And I trust that and pray that this program will continue to do the same. Today's program is part one of part two on racism and our family's health. And to start this program, we want you to understand how important it is for you to take note of these particular items or topics, rather, that we will be opening up to you and probably revealing to you things that you didn't even know that were happening and how racism affects every aspect of our lives. And so we're going to be dealing with what is racism. And we've lost contact to the realities of what it is, and it's broader than just black and white. Okay. And what are the types of racism? We're going to answer that question as well. And does racism matter, okay, in our what? Church worship? Does the church have anything to say or to participate in racism? We're going to deal with that as well. And finally, does racism affect the health of the people of the Bronx and beyond the people of the Bronx? But we're going to dwell with the Bronx because it leads all districts of the state of New York for the worst health that could ever be. Now that's got to stop. And this program is aimed towards changing what we heard of, and many of you have heard the word or the numbers 62. We're going to tell you all about that and how you can make a difference. We'd like to introduce our guests. And we want to, in introducing our guests, I would like to thank the Institute for Family Health, Bronx Health REACH, for coordinating this program. And at this time, I would like very much to introduce Immaculada Moronta, who is the Program Assistant Coordinator for the Institute of Family Health. Immaculada Moronta, welcome to Church Alive.
Thank you. Thank you for having us, Bishop Birkett, and we appreciate this opportunity. We are here to discuss the importance of why the conversation on racism matters, the impact it has on our health, and how to share what we are doing as a Bronx community-led coalition to address this public crisis. Bronx Health REACH, we are a program led by the Institute for Family Health, and our mission is to eliminate racial and ethnic disparities in health outcomes in the Bronx by creating a movement of individuals, agencies, organizations, communities working together, sharing resources, expertise, information, and services. So racism is a public health, and as a group, we found that it was urgent to have more houses of worship understand the role of racism in our lives today, identify it, so they can be the vessel within the community to share this knowledge. Since 2020, we have hosted an annual event, Racism in Our Family's Health, Connecting the Dots, where the planning, the agenda items, and the action items is a product of pure hard work of our Bronx community and clergy members that form our faith-based outreach initiative, which includes partnerships of more than 20 houses of worship in the Bronx. We have had experts on the topic, including health providers, clergy leaders, trainers on education, on to dismantling racism. And lastly, the Bronx continues to be the unhealthiest county in New York State in terms of health outcomes. So to address this, the Not 62, hashtag Not 62, the campaign for a healthy Bronx, is a movement, is a call to action to improve the overall health status of the Bronx residents by addressing the social, economic environment, health behaviors, clinical care, and the physical environment through collaborations and partnerships across multiple sectors in the Bronx. And we are very excited to be here. Thank you, Bishop Birkett.
Well, I want to commend you for the work that you've done to move uh, 62 from just a number and words into a movement. And I trust and pray that those who are watching this program right now will get on board. And we're going to tell you at the end of this program how you can be part of this campaign. We have two special guests, and they're almost like religious partners when it comes to the needs of people here in the Bronx. They're both pastors. And so at this time, I would like to introduce to you our Reverend Dr. Calvin Kendrick, who's the pastor of Grace Baptist Church. Welcome, my brother.
Good day, and thank you so much for having us today.
Okay. And the next pastor, I've really learned over years that he's more than a pastor to me, he's a friend. Both of them are associates in this great work of meeting the needs of God's people. And so I would like to introduce Pastor David Powers, who is Roman Catholic, St. Helena Church. God bless you, my brother.
Thank you very much. It is a pleasure to be here, and this is an important topic we're discussing.
All right, we're going to get right into the topic. I know a lot of you have first time you've heard racism and what is racism and clarification of it. And we've had it going all the way back many years, but there's some nuances about racism that you need to understand, and most of all, how it affects our health. And so at this time, we're going to ask a few questions of our guests, and they're going to respond, and they're going to allow you to understand what racism really is. And so the first, our Reverend Kendrick, we want to deal with what is racism.
Thank you so much. As we know, racism is a growing crisis in our living today. Racism is a conscious, discriminatory, oppressive activity directed at a particular victim by individuals. We find this to be true in our news, what we hear today. Racism can take on many forms. And we know that some of the forms that it takes on are slurs, hate crimes, anti-immigrant propaganda, different things like that. And so racism is something that is manifesting itself as forms. It is recognizable, and we have seen racism in our own time and day, and we hear about this all the time.
Well, Reverend Kendrick, just expand a little bit. You mentioned there are different types of racism. Let's try to take them one at a time and see if we can really educate our audience.
Yes. So we find racism as to be internalized racism. We find racism in interpersonal sectors, institutional, and structural. Now, when we look at this, internalized racism, this is when a person accepts negative messages and stereotypes about their own and other cultures and races in their belief system. Now, this kind of racism is very, very toxic because all racism is harmful, but this is especially toxic because this kind of racism is not only challenging outside of cultures, but people are prejudiced within their own cultures. And so internalized racism is viewing white as norm or the ideal. It is dealing with white or light skin over dark skin. It's dealing with even family members that if you're darker or if you're lighter, so internalized racism. Not only that, but we also have impersonal racism. And impersonal racism is when a person's conscience or subconscious racist bias influences their interactions and perceptions of other people. And so we look at this where we have microaggressions and different things like that. Let me give you an example. Like, for instance, you go into the store and the person, the clerk or the guard is following you around because of your culture, the color of your skin. And they've already prejudged you for what you look like. And so they're accusing you already for doing something that you did not do. And so that's another part of racism. The other part of racism is institutionalized racism. Institutionalized racism is another toxic piece. So the implicit or explicit and regulations within an organization discriminatory and against marginalized communities. For instance, when we have these kinds of institutionalized racism, they actually favor white patients and white people over black people or any person of color, different things like that. Institutionalized racism uh, is is set there, but then you have structural racism, which is a whole. It's like the umbrella of all of these racisms. So, what do you have in structural racism? You have bias laws, policies, and practices that restricts people's access to services, opportunities, and resources because of their race. So you have that. And so these are the different types of racisms. And let me just conclude by saying when we see racisms like this, racist tones, we see it in housing, we see it in the criminal justice system, we see it in public health, education, banking, and all of this comes against a people. And as you probably heard on the news recently, how the people are being stopped and frisked illegally, illegally. Even now, even though it's stopped, it's back, but it's not being done legally. So this, and it was 97% of black and people of color being stopped. So that's another form of racism.
Okay, we're going to come back to you to deal with racism and how it affects getting medical care, going to the hospital, and how
Yes.
we're treated, okay, in that area. And because many people go for medical care and even in the emergency room,
Hmm.
I've been through that situation where I just, sat there, and I said, when are you going to take care of me?
Right.
And I see these people coming in, and I'm telling you, the white folk, and they're going from the emergency EMS right on through to a doctor, and I'm still waiting there,
Hmm.
screaming and hollering, and the more I hollered, I guess that gave the structure that this brother's the problem. But I ain't got a problem. I just want to get help.
Hmm.
Okay. Now we're going to go to our brother Powers. I say brother Powers. I don't have to say Reverend Powers because we are fellow ministers. Okay. So my brother, the church is racism in the church,
Hmm.
and how does it affect their mental health and how our members worship and whatnot like that? Go ahead, brother.
We know that racism, one of the effects of it is causes low self-esteem. Low self-esteem causes poor health. How people treat one another affects you physically, affects you spiritually. I want to quote from Mahatma Gandhi. Mahatma Gandhi said, I do not have a problem with Jesus, but
Mm.
I do have a problem with his followers.
Mm.
Oh boy.
Jesus taught us that we are to love and to treat one another with dignity and with respect. Now, 2 weeks ago, do you know the state of Florida, the NAACP, issued a formal travel advisory that the state of Florida has become openly hostile toward African Americans and people of color, saying the state devalues and marginalizes the contributions of the challenges faced by African Americans and other communities of color. There was an article in the New York Times that said why Christians must fight
Mm.
systemic racism. When churches point out bias or racism in healthcare, housing, policies, or employment, they are doing the most Christian of practices, naming and resisting sins, personal or collective,
Mm.
structural and persistent injustice. In the Gospel of Luke, remember Jesus quotes the prophet Isaiah when he says, "He has come to set the oppressed free." Christianity tracks that human beings left to their own devices often pursue their own distorted interests. And when we do that, we call that tendency sin. That's something we don't always recognize enough. All right, what did Jesus teach? Jesus taught us that we are to love and to treat one another with love, dignity, respect. And that's not happening. And when that is not happening, the churches have a responsibility to speak up. We cannot be silent. When there is, this is what Jesus came to set the oppressed free. Jesus came to bring love. And this is what his church must do. John chapter 14. If you love me, you will do what I say. You will keep my commandments. Are we doing that? It is time that we speak the truth. Churches, Christians, pastors, individuals. You were made for more. Jesus wants to do something different in your life. Right. We know that racism is a sin. Sin is oftentimes prompted by the devil. I want you to consider this. The devil believes in the word of God, but he does not respond to it. Now, we at St. Helena's, we have a school that goes from 3-year-olds to 8th grade. Have you ever gone into a classroom full of 3-year-olds? Doesn't matter what color, what shape they have. There are African Americans, there are white, there are Asians, Bangladeshis. It doesn't matter. Walk into that room and they are playing with each other wonderfully. They're not just playing with the ones who are the same color they are playing with everybody. What happens to us that we stop doing that? Why are we not interacting with all of our brothers and sisters the same way the 3-year-olds, the same way the 4-year-olds? Somehow they got taught. They got taught the wrong thing. It's the responsibility of the church to teach the right thing.
Okay, we're going to take a break and come back, and I'm going to bring you some questions about the church's role in advocacy for quality health, medical care, and what do we do? Because when they come to our church, our prayer lines, we find that they're sick. And sometimes we tell them, we're going to pray on it. But sometimes these sicknesses need a doctor. And Jesus made that clear as well. And so we're going to come back and deal with that issue and why the church is taking this role of advocacy, working with the Institute of Family Health and Bronx Health REACH. We'll take a pause and we're going to be right back.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211, get connected, get help.
All right. We've got 2 pastors on here right now, and we have some real terrible problems. Both of us, 3 of us rather, we pastor churches in the Bronx where the health is the worst out of the state.
All right.
Yes, Brother Kendrick.
Yes. Okay. So when we spoke about the fact that the attention is not given to Black patients as well as white patients, sometimes that falls under institutionalized racism, where doctors are more likely to favor white patients over Black patients. And sometimes your doctor changes because they don't want to serve you. I met a doctor who said that Black people don't get all the information that they need to have. And that's a serious thing, because sometimes you would think that people would think that Black people, doctors may believe that black people could stand pain more than white people or something like that. But it seems like the doctors in this situation comes to a point where you're not getting the attention. You go to the emergency room, you're sitting around, nobody's paying attention to you. I've been in hospitals or clinics where there have been in white neighborhoods where I got the attention immediately. Well, you go to another neighborhood like in the Bronx, and it just it's just that you're sitting there for a long time, no matter what the pain is, and people are not paying attention to you. And even when you get into the hospital, the room, it seems like things are not the same. And if you go into the different neighborhoods, you'll find that there's a difference.
Okay, Brother Powers, give you a scenario. Members in your church, it's call you and say, Pastor Powers, Sister James is in the hospital, and she's still waiting for medical care. And what is the role of the pastor when he feels that the members and the people of his community are not being treated well in the hospital? Should he just say, pray on it, God will deal with it, or should he take an effort to go?
I think a pastor has two responsibilities. First and foremost, he has a spiritual role, and secondly, he has a advocate role. So I might be able to go to the hospital, see how my parishioner is doing, be able to pray with her, and then occasionally I might be able to go up to the nurses, go up there and saying, oh, my parishioner has been here for a while. What is the situation? In a nice way, give what we call those gentle nudges. And sometimes people will respond to that. Oh, well, I didn't realize that. They might be an excuse, but oftentimes that will be followed by her being seen a little bit quicker. Meanwhile, we have members of the parish that continue to pray. We have a prayer line. So immediately that parishioner is going to know that I'm going to be put on the prayer line, and I am going to have people from my church and from other churches who are going to be praying for me. And that is oftentimes comfortable.
All right, so what you've done is to take a holistic approach to that need.
Yes.
In other words, not only spiritually, but physically getting involved.
Okay? Yes.
We have some issues here that I want to ask our brother Kendrick.
Yes.
In the area of racism, how can it affect a person's health?
Well, first of all, it's very unhealthy, and it affects a person's health. It could affect a person's health mentally with mental challenges, worrying. Can I trust the person, the surgeon that's going to be doing the surgery on me? Can I trust the report that is given to me? A personal thing happened to me. I went to a doctor in the Bronx, and he examined and did all that. But I also have a doctor in Manhattan, and when the results came back, all of these tests that was given to me in Manhattan, I got a full range. In the Bronx, I got about 4 or 5 things, and I said, "Did you test for this? Did you test?" "No, we don't test for this. We don't test for that." So how do you expect to have better health if they're not testing for everything? And so when I compared the two, I said, well, I'm going to stay with the Manhattan doctor. It is unhealthy because now you're thinking, am I getting the truth about what's going on? Are they testing for things that I need to be tested for? So I did that study on my own with a hospital in the Bronx and a hospital in Manhattan. Different results in regards to, or more results of a full result that came about. So it's challenging because what happens in this is that people are afraid to go and get news that may not be totally bad news, but they'll give up on you. Sometimes I say, are they putting doctors in our neighborhoods in the Bronx that probably graduated at the bottom of their class and putting good doctors somewhere else where they're getting the best health?
And the
My
answer,
personal experience leads me to believe that.
the answer is yes.
Yes.
Okay, we are looking at a part two of this. We've opened the box to something fantastic here, and I know it's going to help millions beyond the Bronx. We're going to ask us, Moronta, to share with us. The Immaculada Moronta is the uh, assistant coordinator for all of this. Tell us, what is the next step in Bronx Health REACH in our next program and in the further programs to come? We got about 2 minutes.
Yes, thank you, Bishop. Just to add to Dr. Kendrick remarks, race does affect every aspect of our lives, not just the healthcare part, but we are in racialized communities. We're more likely to live in food deserts, right? Polluted areas, and have lower quality healthcare, as we've also talked about today. So it's more than that, and it goes deeper than that, and it affects everybody. For example, likelihood to be stopped by police, have lower graduation rates, salary, and many other disadvantages that I believe there's not enough time, but they're so important that we to discuss with each other. But as what we're looking for here, what we're asking the audience is it's to ask. We would like for them to join us next week to discuss further this conversation, and we're going to focus more on what is like why is it wrong to say I'm colorblind and I don't see race, and really understanding that topic. We also want to talk about the importance of the New York Health Act and what the benefits that it could have to all New Yorkers, not only the Bronx. And definitely looking forward to invite folks to join our events. As you know, we have an annual event focusing on this topic, and we invite all houses of worship as part of our Racism and Our Families Health Connecting the Dots, which we are hoping to have on this upcoming September.
Okay.
So that's our ask for the audience.
All right. That gives a lot of emphasis for people to watch the next show. And so at this time, we want to thank all of you who have been with us on this part one to get ready for part two. But get engaged, get involved, because your life and the life of your family and members and your relatives are at stake. Thank you so much. And we say in closing, we love you with the love of the Lord.
Blood, but in no way.